the only way to truly grow hair is from the inside. So we have to create a formula that will rebalance your entire human body system. When you take the blood work after taking our formula, you take it to your annual physical, they'll give you an A bill of health.
Dr. Ray Nettles is redefining hair and hormone health with data-driven precision, transforming patients through custom biochemical insights. Get ready for a conversation about real results and lasting health.
Good morning, Dr. Ray.
Good morning, Tracy. How are you?
I am doing very well. Thank you for asking. And how are you doing today?
Today better than yesterday, and I hear that tomorrow is better than today, so we're sticking around.
Very good, very good. All right, so today we have another super hot topic. After doing finasteride last week, this week we have minoxidil, which is probably the most famous hair growth, I'll call it growth drug available on the market because it doesn't really grow that much. But anyway, so today what we're going to talk about is minoxidil, the plateau, the shed, the side effects, and why we don't use it.
All right, very good. Thank you, Tracy. It surprises me that people are still talking about the molecule known as minoxidil.
Yes.
The people that must be calling in must be over 50 years old because the minoxidil was discovered in 1963. So if it actually ever really worked, everybody on Earth would have hair. No. So that's the first giveaway. It was discovered in 1963, 60 years ago. And they first created an oral medication for hypertension because it vasodilates, it dilates vessels. And just think, if you dilate blood vessels all over your body, it might produce a little bit of vellus, the baby fuzzy hair growing all over your body. And 1970s, after they launched the oral hypertension medication Upjohn that turned into Pfizer today, now owned, I think, the Pfizer. So they marketed it as a hair growth product because they discovered that it grew some hair in other areas, but that's vellus hair. Now, the reason why it grows vellus hair was not because of the same reason that it vasodilates. The reason it grew some of the topical was because it was a prostaglandin E, as in everywhere, receptor. So they had a molecule that worked on prostaglandin receptors on cells E everywhere. So if you put some on the topical on the head, it grew a little fuzzy hair over about 12 months, but that hair would never turn into terminal hair. So years later, about 25 years ago, when I was doing my ophthalmology fellowship, we were treating glaucoma patients, and I noticed something surprising: real terminal lash growth using a topical eye drop. So we discovered that those eye drops would actually work on a different receptor. They worked on the prostaglandin F2 alpha receptor, very specific to the face. Well,
I think it's just head hair even, right? I don't know that does it work anywhere else on the face or just head hair?
So the prostaglandin F2 alpha, there are several molecules. We discovered that one of them worked better on the lash receptors. And then we found another one that we use for the hair, and that's a prostaglandin F2 alpha, but it's called latanoprost. The reason why people don't really talk much about it, it's the most expensive, not just hair regrowth, it's the most expensive, not just for topicals, it's the most expensive molecule on Earth. $500,000 a pound. Forget about gold. Forget about diamonds. Hair growth, Tracy, the hair on my head is more valuable than any other substance on Earth. Hair on your head today for humans is more valuable than anything else on the world. That is amazing to me. It's shocking. But
It is amazing.
$500,000 a pound just to order the ingredient to make the first bottle. So
Why is
imagine
it so expensive though? Is it really hard to make?
once again, hair on your head as a human animal has more value than anything else on earth. That's what the humans are proving with their behavior. They price the molecule. They cause the molecule to have its price. It has a price based on the perceived value of humans. It used to be copper, it used to be bronze, it used to be iron, it was diamond, it was gold, it was oil, it's a dollar bill. Today, hair on your head is more valuable than any other substance on earth. So imagine you've got hair on your head, you're worth so much to people in people's eyes. And now they can figure out how to grow it by finding our company. We've been doing this for 20 years. We have clients or patients on 6 continents. Everybody on earth knows that we can grow their hair. Whether or not they've made the decision to actually do it is different. That's the pride of the human wanting to do it their way. A lot of times people come in, Tracy, through the consults, and they want to tell me what they're doing that's not working. They want to share with me what they would like for me to use on the. I said, how about you use the molecule and the formulas that we've proven that have worked? In 20 years or so, when we're gone, they will lose this ability to grow. I guarantee you, they will lose the ability to grow hair. Why? Marketing people will come in and destroy how simple it is to grow hair by first doing blood work and then using the right molecules and the right formulas and the right percentages. But if something's $500,000 a pound, there is no way the Walmart brands out there, Happy Head and Keeps and Hims, are going to use the 100% the amount of the ingredient. They would have to sell their products for $200 a month. And they're not willing to do that. And there's a swath of people in the world that are just cheap. They just really don't value themselves enough. And they're willing to spend $40 if it does work. If it doesn't work, just that's the way it is. And that's ridiculous. But if you look over the United States, I think only 25% of proficiency in math, less than 30% proficiency in English. So no, this is why I imagine we have now clients in 6 continents. There's not enough people in the United States that can find us, unfortunately. So I hope that Donald Trump gets out there and he's doing a great job, continues to do a great job reforming the education system in the United States, because you've got the Democrats that want to make everybody dumb and have to be dependent upon government subsidies. And then they want to run the shell companies and make the money. So you make 1% of those people rich and the rest of the people are ignorant and poor. It's ridiculous.
Yeah. Yes. All right. So let's get back to talking about minoxidil, right? And so you talked about it a little bit before, right? That it was originally found during a study when they were testing it for its vasodilator. And you did mention about it is seeing a resurgence, right? So you asked me about the ages. We have new young people coming through that have been, because they've relaunched it as oral. So a lot of doctors and dermatologists are now prescribing the oral version of it, not the topical one.
Okay, so you've got the skin doctors, dermatologists that now have an oral capsule, another oral capsule. So the skin doctors used the finasteride from the urology department, and they used it for 6 hours in a 24-hour day. And if they had prescribed it 4 times a day, it might have worked, but nobody would have continued on that type of program. So now they've mismanaged the finasteride oral capsule. Now you've given them another oral capsule and changed their blood pressure. And these are young people that are going to have changes in their blood pressure. Just imagine what's going to happen. You're going to have the cardiologist seeing some of these young people for taking a medication that works with their blood pressures in their heart and their vessels. I don't know how it was approved. Money. I know how it was approved. Money. And everybody wants something cheap. So you get a lot of these young kids that are young and dumb, ignorant of the science, and they don't have a lot of money, and you sell them a cheap product. I think that's fraudulent, and that someone should look into it.
Yeah, I agree. Yeah, it's not good how they're not giving them the right advice, right? Especially now we have the education around doing precision medicine and understanding each individual and what's going to happen from these things. So it's not good. All right.
Tracy, just think that people. Here's what my question is, as a technology person yourself: how can someone not find Stop Your Hair Loss and Regrow Your Hair? Our company's called Stop Your Hair Loss and Regrow Your Hair. So if you were to type into Google Stop and Regrow, you would find us every single time. And I think it's less than 1%. Less than 1 out of 100 people in the United States can figure out, if you wanted to stop your hair loss and regrow your hair, you would type in stop and regrow.
Now that we have AI, you don't even need to do that, actually. You can just go to the AI and ask, what is the best solution for treating the underlying cause of my hair loss?
Hold on. That's a lot of fancy words. So forget the underlying nonsense. How about stop? Maybe that's why. Maybe AI will find us more frequently, because we're the only company that says something honest and it makes sense, common sense. We stop and regrow your hair. Keeps and hymns are marketing memes. So imagine someone, but the question that everyone should think about: who is the authority of the knowledge? Stop and Regrow has a medical team, medical doctors, pharmacists.
Led by you. Yep.
The other groups are marketing teams, marketing companies. Pfizer recruited influencers to sell products. And that's why none of them have hair growth. But now with AI, everyone can pretend to grow hair. We found a company 4 years ago in South Africa. We have a client in Africa, and we found a clinic in South Africa that was doing something very similar to us. Some of the pictures looked almost the same as ours. We reached out to them, and nothing, not a word, an email, a phone call, nothing. It was an AI generated a scam.
Yeah.
So be careful. Be careful.
Okay, so let's go back to minoxidil. So you talked about what it was, right? So it's a vasodilator, and it has a mild impact on some kinds of hair everywhere that only grows a little bit of fuzz. So that's why when people are using it, some people, because actually the research showed that it doesn't work for everybody. In fact, it doesn't work for most people. And for the people that it does work for, it grows that kind of fuzz. So it can make your hair look like it's filling in for a period of time, and then it stops becoming effective anymore. And in fact, then you can actually end up going backwards. And if you stop using it, you'll lose that hair too, right? That's my understanding, because it requires the molecule to be there consistently. Is that right?
We have a much better molecule. Why would anyone use this molecule? So I thought we talked about it in the beginning enough to dissuade people, but now we're doing a scientific history of why it didn't work. But no, yes. So it's the wrong molecule in the wrong place, and using it orally is absolutely the wrong administration. So this is going to be a problem. But Tracy, if you can teach the followers how to type in stop and regrow, they should be okay. And I think I think with mandatory, everyone had to have insurance in the United States. Now everyone should have a way to get their blood work. So that was one of the biggest hurdles. So thank God for that. Now most people have some type of insurance that'll cover part of the blood work. And that's it. Get blood work. We will determine the exact cause, and you'll see for yourself with your eyes on a screen the exact cause. And I'm hoping if the followers can chime in and ask Tracy to make this, we've got before and afters, but we want to put up the blood work. So imagine if you guys could see the blood work that came in and then the after. What did the blood work turn into? Everyone's so scared, Tracy, of, Doc, what happens to my blood work if I take your formula? You end up with an 18 or a 25-year-old blood chemistry. It will blow you away. Your total testosterone goes through the roof. Free testosterone goes up. Bad testosterone goes down. The estrogen molecule that makes you anxious is controlled. So when you take the blood work after taking our formula, you take it to your annual physical, they'll give you an A bill of health.
Yeah, so we did actually. So remember at the beginning of this series, we went over some people's blood work before and afters and showed the changes that happened when
Yeah.
after
So
they grew
here's
their
what I
hair back.
want. Here's what I'm looking for is I want to create an image of the before hair, and then underneath it, just the nutrition
Oh,
on one
okay.
side and then the genetics on the other side. As soon as you see the after, the split screen will be the hair before and after, and then the BRC before and after.
Okay.
So their eyeballs will see, wow, you made them a lot better. And that's the only way to truly grow hair is from the inside. So
Right.
we have to create a formula that will rebalance your entire human body system. This is amazing that God even asked me to do this. Is something, if he had asked me when I was going through organic or biochemistry, the answer would have been NO. Somehow he pulled me back, and all I do every day is organic chemistry, biochemistry, chemistry, biology, pharmacology. It's not what I thought when I first started out as a cosmetic surgeon. I was going to be using my hands, and I was going to be transplanting hairs and shifting around facial features, and God had a different plan for us.
Because moving the hair around doesn't solve the problem. Isn't that what you found?
I would have made a lot of money, and it would have been fun for the time. But no, it wouldn't have worked. I was so fortunate. One of the hair transplant patients that I performed, I think 15 years ago, came into the office and started on the hair regrowth program 3 years ago. He's
Oh,
doing
really?
great.
Good.
I designed at that time a hair procedure that would fit his future hairline, and he came in at the right time and found us. So thank God.
Good. Yeah, that's very good. That's very good. Okay, great. Perfect. Let me talk to some people that are coming in, and then we'll talk about what to talk about next week. But in the meantime, if anyone has any additional questions, don't forget to like and follow us, and then put those questions in the comments and we can answer those in future episodes. Hi, if you like what you see in our episodes and you would like to see more, please make sure to like and subscribe. The link is below here. And in that way, we will notify you as soon as the next episode comes out. And next week is going to be a great one.